Bienvenidos. Welcome to the second day of our annual Latino Coalition for a Healthy California Latinx Health Policy Summit, Nuestro Futuro, Nuestro Poder. I'm Dinora Perez, news reporter with Telemundo 52 in Los Angeles, and it's a true pleasure for me to join you as a moderator for today's session. So I welcome all of you, and I also welcome all of you to watch us each night at 11 p.m. in our newscast Monday to Friday. You can see me besides this nice panel that we're having today. And we hope you had a great day yesterday and enjoyed hearing from our panelists. We have another great day lined up for you today. I hope you guys are ready. We have more incredible speakers and panelists. But before we get started, we have a couple of housekeeping items to cover. I want you to pay attention to these because this event is being streamed in Spanish and also in American Sign Language. So if you need to access one of those channels, you can do so via the channel at the bottom of your window. That's one. And also, we want to let you know that at the end of each panel, you will have the opportunity to submit questions to the panelists via the chat box on your screen. That's really important. Also, you have to indicate what panelists you'd like the question directed to, and we'll do our very best to get to as many questions as we can today. So, all right, let's get started. You guys ready? I am. So today is our day of action where we'll further discuss which strategies need to be implemented to achieve concrete and, of course, sustainable change. We will be joined by fierce intersectional Latinx equity advocates who are championing multiple issues and envisioning the future of Latinx health equity and justice. We will close out the summit with a dynamic panel of policy advocates who will share their perspectives on policy solutions and health systems transformation towards health equity and racial justice. So let's get started. It's my privilege to introduce our special guest speaker, U.S. Senator Alex Padilla. Alex Padilla serves as California's first Latino U.S. Senator, and as California's junior U.S. Senator, Padilla serves as chairman of the Judiciary Subcommittee on Immigration, Citizenship, and Border Safety. He also serves as a member of the Senate committees on Budget, Environment and Public Works, Homeland Security and Governmental Affairs, Judiciary, and Rules. And previously, Padilla served as California's his first Latino Secretary of State, where he worked to make our elections more accessible and inclusive while fighting to protect the integrity of our voting systems. Senator Alex Padilla is the proud son of immigrants from Mexico. His father was a short order cook and his mother a housekeeper. Padilla attended Los Angeles public schools and is a graduate of the Massachusetts Institute of Technology, MIT, where he earned a Bachelor's of Science degree in Mechanical Engineering. Welcome, Senator.
Hi, I'm Senator Alex Padilla. I have the honor of representing California in the United States Senate, and I'm proud to be the first Latino to do so. Thank you for inviting me to join you today during Hispanic Heritage Month to discuss the future of healthcare in Latino communities. And thank you for coming together to have these important conversations, to share best practices, and to reflect on the lessons of this past year. The COVID-19 pandemic has highlighted the importance of healthcare advocacy with strong community roots. It has also laid bare the buildup of inequities in our healthcare system. As we look to the future, we need to apply the lessons that we've learned to improve equity in all aspects of healthcare. The COVID-19 pandemic hit especially hard in Latino communities. That outsized impact is no coincidence. Latinos make up half of all frontline workers in California. Latinos are also more likely to live with pre-existing conditions and have less access to critical medical services. We need to address these inequities as we support a full recovery from the COVID-19 pandemic and prepare to face new challenges. I cast one of my first votes in the Senate for the American Rescue Plan, and I'm proud to have championed equity in its investments. The ARP brought tens of billions of dollars in direct assistance to help families, cities, schools, and small businesses survive the pandemic. It also sent $1 billion to 175 community health centers here in California. This money improved access to COVID testing, treatment, and vaccines for all Californians. And thanks to the aid in the American Rescue Plan, more than 56 million doses have been administered, helping protect more than 2/3 of Californians. But this is just the beginning of our recovery process. If we do not take action, Latinos will continue to face disproportionate health risks. Latino children in the U.S. are twice as likely to lack health insurance as non-Latino children. Latinos are also more likely to live in areas most vulnerable to wildfires, flooding, and other impacts of the climate crisis. To protect Latino health, I'm fighting for bold action as Congress advances the budget reconciliation process. We need to preserve the expanded child tax credit, which benefits nearly 8 million California children and will lift over 500,000 out of poverty. We need to invest in wildfire prevention and clean up legacy pollution that endangers communities of color with harmful air and drinking water quality. Because the health of Latino families is closely tied to the health of the planet, we need to make sure the new budget fights the root causes of the climate crisis and invests in long-term change. Congress is making a generational investment in American infrastructure to support a full recovery from the COVID-19 pandemic. It's critical that we seize this moment of opportunity to build a better future for all. I want to thank all the members of the Latino Coalition for a Healthy California for your work to promote equity in healthcare. You are looking to the future and setting policy priorities that will improve healthcare for communities of color and immigrants in California. The work you are all undertaking is timely and critical. Please know that as your senator, I'm committed to building healthy communities for Latinos and for all Californians. I wish you a productive summit and look forward to our continuing partnership.
Thank you very much, Senator Padilla. We are so proud of your leadership in Washington, and we're continuing with this panel. And up next, we have the honor to welcome Bambi Salcedo. Bambi is the president and CEO of the Trans-Latina Coalition, a national organization that focuses on addressing the issues of transgender Latinas in the U.S. Bambi developed the Center for Violence Prevention, Transgender Wellness, a multi-purpose, multi-service space for trans people in Los Angeles. Bambi's remarkable and wide-ranging activist work has really brought a voice and visibility to not only the trans community, but also to the multiple overlapping communities and issues that her life has touched, including migration, HIV, youth, LGBT, incarceration, and Latina communities. Bambi received her master's degree in Latina Studies from Cal State Los Angeles. And I personally know Bambi, so it's really good to see you, Bambi, today. Muy bienvenida.
Muchas gracias. Thank you so much for the opportunity to share space with the beautiful and amazing people today. Thank you.
Well, it's all yours, Bambi. We will let you give us your remarks and how important this panel is to you.
Bueno, primero que nada, saludes a todas las personas que nos
First of all,
acompañan.
I want to say hello to all those who are here.
To share space with all of you. You know, I'm so grateful that this platform has been put together to specifically talk about the LGBTQ issues and Latinx issues that really impact our communities. And you know, I do have the privilege to be the president and the CEO of the Trans-Latina Coalition, which is a national advocacy organization that also provides life-saving services to trans and gender non-conforming people here in Los Angeles. We are one of 3 trans-led organizations here in Los Angeles, but we are the only one that has a multiplicity of services and support for members of the trans and gender non-conforming community here in Los Angeles. But the work that we do, it's more than that. We not only provide support services to our community, but we also do campaigns to release trans people who are in immigration detention, who have been detained for years. We also, do policy, which is one of the ways for us to be able to change the structures that continue to marginalize and oppress our community. And so our organization really is set to create the changes that need to happen in our community to ensure that all of us have a better quality of life. And one of the reasons is that we do the work that we do. It's because as we know, trans people continues to be not just marginalized, but also criminalized because of who we are. Specifically for trans women who are fleeing their country due to the violence that we experience, it's important that we serve as a voice, not just for them, but again, to the broader trans community. And that's certainly the work that we do. And we continue to create history. I'm really happy to report that here in California specifically, last year in the middle of a global pandemic, we were able to make history as an organization in collaboration with a statewide coalition made of trans-led organizations. And that is the passage of Assembly Bill 2218, which is the Transgender Wellness and Equity Fund. And this year, through our budget advocacy, we were able to allocate $13 million specifically to support the work of other trans-led organizations and to help us build healthy trans people across California. And what we're going to do is that, we set precedents in this state. Like I said, we made history, and we want to build this model across the United States and across other states for our community as a whole to be able to not just build our political power, but also to build our economic power, and for us to also continue to have better qualities of life and eliminate the violence and the discrimination that we continue to face as a community. So I'm looking forward to sharing space with all of the beautiful people who are here. And I'm just so grateful that I get to participate and really do the work that I do, that we do. And certainly want to highlight that the work that we do as an organization, it is not possible if it's not through the collaborations of not just the people who are here, but also people who are out there and people who are part of this summit. And so I just want to express my gratitude and my appreciation for all the support that you have provided to our organization, for us to continue to be one of the leaders in the trans movement across the nation. So thank you so much, Bambi Salcedo, con mucho amor y mucho gusto. Gracias.
Gracias, Bambi. Siempre con mucho amor. I appreciate you for participating in this panel. And up next, we have Brian and Jesus. So we're welcoming Brian Hatcher. He's a program associate for Communities United for Restorative Youth Justice, known as Courage. Brian has been organizing with Courage since 2018 when he started on this journey to end youth incarceration. The first step he took with Courage is life coaching. And from there, Brian has organized, co-hosted, and performed at events with hundreds of community members, including Oakland's Juneteenth celebration and the Dream Beyond Bars block party. Brian is also a formerly incarcerated youth who has transitioned to become a youth advocate. He loves the work he does because he can prevent issues that may occur in his community and to others worldwide. So welcome, Brian. And we're also welcoming with him Jesus Martinez Cova. He's a coordinator with Dream Beyond Bars, and Jesus became a part of Courage in January 2021, but has been working in the communities in the Bay Area for a good 10 years strong. And as a youth, Jesus was incarcerated at 14. He was sent to a group home and programs, born and raised in San Francisco, California. And he says his heart belongs to both of his communities. Is that right? Bayview, Hunters Point, and the Mission District. And with that, we welcome you both. Bienvenidos. The microphone is all yours.
Thank you. Thank you, Lenore, for having me. Thank you for letting me present. My name is Breon Hatcher, aka Brizo. I'm born and raised in East Oakland. My title at Courage. I'm a Dreamhound Barge Associate. I'm 22 years old, and today I'll be talking about criminalizing youth of color and how it affects our community. My experience with the system was very rough. I felt like none of my needs was met. Like the first initiative they took was just locking me up instead of just trying to understand like some of the issues I went through. I lost my mother at 3. My dad was never there, so just knowing that it's hard to just grow up in a system to where our color is already in poverty, and they want us to be undermined. So I just felt there to where like police is not our advocates. They always come with us as like we're a threat instead of just seeing what's wrong. And just like 9 inmates in the Santa Rita right now, it's 44 cases of COVID, and that's 4 times a couple weeks ago. And that shows that they don't care about nobody else. Like people are dying in there, like it's severe cases, and them people in there is going to be the community at the end of the day. So it's like that steps from just shutting down the DJJ. Them people, if it's a set system for us that might go to jail, so the people that's going to jail, we need to rehabilitate them, and that's not a system to rehabilitate. And something we say at Courage is close youth prisons, build youth leaders. And that's a quote we say, because right now we have to do that. The leaders is our kids right now, all the high schoolers, that's our future. And we're currently working on SBA 23, which will close down DJJ, which is formerly known as CYA. That would just help a lot because right there, kids is not learning nothing. We could just be switching the whole system to where we can learn now. We could be in a nonprofit work instead of being locked up. And now they learn policy and learning laws and preventing them from doing some of the crimes they did and understanding why. I feel like this is very important to shut it down because and no growing in there. Like we're being locked up in cages, treated like animals. There's a lot of angry young men in there. So what does that cause? More crime inside of the juvenile halls or the jails. So I feel like just that's the main priority, just shutting down juvenile hall systems to where they can be in more nonprofits. We can get certified and do way bigger things if they take time and spend money on that instead of spending money to incarcerate us. So one quote I want to say is kids are our future. So while we keep locking us up and stopping us from growing, that'll stop our growth. Like it's just like keeping us in a small tank. And if we could be a shark, we could grow longer if we just be in the ocean. And just thanks for having me, everybody. I appreciate it. And I'll pass it back to Lenore. Thanks.
You pass it on to me and I pass it on to Jesus. Jesus, are you here with us?
Yes.
Welcome aboard.
Thank you. Hi, everybody. Well, my name's Jesus. I'm the Dream Beyond Bars coordinator here at Courage in Oakland, California. I've also been formerly incarcerated, so I've been impacted by a system like Brizo. I'll be following up, locked up at the age of 14. I turned 15 inside the group home, so I've been in that system as a young adult. I've been convicted of a crime that I didn't do, so I got to see the flaws of the system as well and the problems that we need to resolve. And in terms of health, like our health here in our community, like it affects people in terms of like depression or just hypervigilancy or, just being in the cage, separated from your family. And I feel like in order for people to really heal, we got to be around our family. We got to be involved. We got to be surrounded by love, And I just a quick little story. I remember being inside the group home and my little brother was only like 4 years old. And he'll be like, Mom, ¿por qué lo estamos dejando aquí? Why is he here? And I'm like, oh, we're just dropping him off at school. But to be able to try to, share that with your brother and not necessarily tell him what a group home is and for him to process that kind of left me in tears as a young man, I don't feel like that was the way to approach it. So just to further, talk about it, during this whole pandemic, there's been like a lot of layoffs, a lot of people getting fired, and that equated to a spike in crimes. It's like they created a formula to where they know people won't have another choice but to find alternatives to provide for their families. One big move that we did was to defund the Oakland Police Department here in Oakland. And one of the first steps that they took was back in 2020 in December, they released an article and they were criminalizing young Black 11 and 12-year-olds as a desperate measure to sway the community into believing they need police. Like what kind of department does that? Most recently, our community here in the Fruitville in Oakland, California, we lost Michael Cortez to police violence. He was killed by an FBI agent, alongside with the OPD, ATF, and CHP. Mayor Libby Schaaf hasn't let us know why they're here in the first place. The community definitely voiced that they didn't want them here in our communities, because we noticed that when there's more police here in our communities, there's more, police violence. The sad part is there will be no accountability as an FBI agent we're pushing for, but historically, there hasn't been any justice. Another family in pain, rest in peace to Michael Cortez, and just he lost his life to law enforcement. They're riding around like cowboys in our communities with a lack of accountability. So one thing I will say, instead of investing in more like locking people up, we need to have more programs like Courage or like APTP, because we meet youth where they're at. We teach them the hard language of policy. Like Beyonce, we're working on SBA 23. We're going to close down the DJJ, formerly known as CYA, which is like a youth prison. And instead of giving the money to those places, we'll be giving that money back into like nonprofit organizations and CBOs, and each like local county can figure out like how much and how to divide that money, because we understand that all the counties are like different and they have different needs. We're currently working on a Crisis Act bill, where basically instead of sending officers to a place where someone's having a mental health crisis, we will send professional like people who are done this work and interact with the people during a mental health crisis, so we could reduce the amount of people getting killed. Because, for example, rest in peace, Mario Gonzalez, he was having a mental health crisis in Alameda County. He was killed. Then we're also working on Decertification Act. Basically, any cops who are convicted of serious crimes or terminated due to misconduct will be stripped from their badge. So there's all kinds of policies where we're helping young people who are formerly incarcerated be able to learn about these policies, understand the language, and get involved and speak. I think Breon's a good example. But basically, that's where the healing is. That's where the empowerment is, to give people a voice, to be involved, to know what's going on in the community, and to be able to advocate for themselves and their people and their peers. We need to have like more community warriors, less police presence, more jobs, more opportunities, more mental health services. It isn't a perfect fix, but that's the world I would like to live in, a world of abolition and a world of freedom. Thank you.
Thank you, both of you, for those thoughtful remarks. It's really great to have both of you here with us. So we appreciate your participation. And next we have Veronica Garibay Gonzalez. Veronica is the co-founder and co-director of Leadership Council for Justice and Accountability. As a first-generation college student, Veronica attended the University of California, Santa Barbara, where she earned a Bachelor of Arts in both psychology and law and society. Veronica Garibay immigrated from Michoacan, Mexico at a very young age with her family, and she grew up also in a small farm worker city in Fresno County. Welcome, Veronica.
Hi, everyone. Good morning. Thank you.
Good morning, Veronica. It's all yours.
Thank you. So, buenos dias. My name is Veronica Garibay. I work at Leadership Council, and our work is focused in the San Joaquin Valley and the Eastern Coachella Valley, so inland California. And we work primarily with lower income communities and communities of color, primarily farm worker communities in both of these regions. And our work has focused on the interrelated issues of land use, water, housing, climate, transportation, air quality, government accountability. And while it sounds like a long list of issues to work on, that's a lot. We have found that our communities are not facing single issues. They're facing multiple issues at once, and that require organizing and advocacy through a more holistic lens that sort of recognizes and acknowledges the impacts. For example, we work with communities that don't have safe drinking water in their home, but they're also living in really dilapidated housing conditions because there are no affordable housing options in our communities. The multiple generations are living in one home. and then there's also no transportation service to connect to school, to connect to healthcare, to connect to a job, for example. And so our work really sort of centers around social justice and environmental justice, and making sure that our communities are protected and are leading advocacy efforts and centered in local, regional, and statewide policy discussions as it relates to environmental and climate justice issues in our communities. We know that for far too long, inland communities, the communities of the San Joaquin Valley and the Eastern Coachella Valley have sort of not been included in decision-making around critical policies and programs and funding opportunities that would address multiple issues. And while we fuel a multi-billion agricultural industry, we don't see any of those benefits in our communities and in our backyards. And I know my dear colleague Francisco will talk about this and some of the implications around housing and what this means. So I won't touch on that for now, but I want to say this: climate justice is racial justice, is health justice, is housing justice, and is environmental justice. And we need to sort of make sure that we're centered that in our work and advocacy. We work directly with community residents to identify what those solutions are. So oftentimes we see governments, local, state governments, and decision makers come to communities and tell us, like, here's what we're going to do, here's what the solution is. But rarely, if ever, are we really working through a co-empowerment framework and lens that really takes from communities what the priorities are and what their solutions are. And so, we've all been through a global pandemic, are continuing to experience the impacts of the pandemic. The pandemic is not over. COVID spread and infections in areas where we work are through the roof. Our hospitals are still experiencing surges. COVID exacerbated existing inequalities. We know, and we've seen data that shows that living in an environment with your air quality is worse makes you more vulnerable to COVID. We know that because of the impacts of climate change and excessive heat waves that we've experienced in the last couple of months, that if you don't have air conditioning or the ability to afford air conditioning in your home, your chances of having experiencing a heat health impact is greater. And we know that until we work together to center community voices in the decision-making process, none of this is going to change. And significant state and federal resources focused on recovery and relief from the pandemic have made their way down to local governments, to state governments, and are on their way to local and state governments. And we don't want to repeat the failures of the past, where those resources intended for communities most vulnerable to impacts of something like COVID or impacts of climate change, for example, don't make it to them. And so a lot of our work is focused on working directly with community residents to do just that. And we don't just want communities and us to have a voice at the table. We need to be at the table, pull up a chair for all of our friends, and then be able to make the decisions. So we don't just want representation for the sake of having communities in the room and checking off a box that says we've now engaged the community. We want community driven decision-making and participatory decision-making processes that allow communities most impacted by COVID and the impacts of climate change that they are making decisions about how to improve our communities. I'll end there with sort of just reiterating, and the previous speakers have raised this as well, just the importance of really listening to communities and engaging communities and identifying the path forward. There is no recovery without community voices at the forefront, and there is no just recovery without centering those voices and making sure that they have decision-making authority over what happens in the next couple of months. Thank you.
Thank you very much, Veronica. That was fabulous. We're going to now continue with Francisco Dueñas. Francisco is the Executive Director for Housing Now, a California statewide housing justice advocacy coalition. He was previously the Director of Housing Campaigns for the Alliance of Californians for Community Empowerment. a position which had him serving as the leading coordinator of Housing Now for the last 2 years. Francisco holds a degree in Spanish literature from Pomona Colleges. He's from Southgate here in Southern California, and we welcome you, and we're very happy to have you with us today, Francisco.
Thank you so much, Dinora. I really appreciate it. And thank you to Latino Coalition for Healthy California and my fellow panelists. Very honored to be here as well. Let me, I guess, first start off. I mean, listening to the other panelists, I work in housing issues, but as Veronica mentioned, all our issues are interconnected. Same way that all our lives are interconnected and interdependent, right? I know because before working on housing justice, I worked on LGBT justice, and I know that discrimination in housing is an issue for the LGBT community. I know now working on housing issues that I know housing for our communities coming out of detention centers and incarceration is an issue. We do not have enough reentry housing programs. And I think, you know, in my time working on housing, it's interesting to me. I've learned that how it touches so many other issues. I mentioned the two right now, but also education. When families are evicted, those students are not able to, you know, leading up to the eviction, there is obviously challenges to their studies. But then when there's a disruption, when they have to move, then those kids cannot continue in their school. And I think the area where there has been a greatest appreciation recently of the impact of housing is in health and in public health. Not just around evictions, although that is one area in particular. Before that, I think people would think about the habitability issues and the conditions of the housing itself, where it is located, and if it is next to a toxic site or if the housing itself is toxic. But I think now we're starting to understand even more structural or systematic ways that housing impacts the health of our communities. Number one, we do not have enough housing for our communities. During the pandemic, we have seen the impact of that, the consequences of that, in that our communities, Latino communities, are overcrowded when it comes to our housing. And we have, we have a less an ability to stop the spread of something like a virus or during a pandemic. But it goes beyond that, because where you live also determines, unfortunately, the resources that you have available to you, whether that is in your school, whether that is in, the programs that are offered by your city, whether you are close to a park. There are many quality of life issues in general that depend upon your housing and where you are living. And the final thing, I would say so many folks in California right now are experiencing homelessness. We have seen those numbers grow and grow and grow every year. And our neighbors that were housed previously next to us are now living in encampments in our same neighborhoods many times. And this is a product of all the things I just talked about. So one, the lack of protections for tenants. Tenants do not have as many protections as they should. to the lack of housing, we mostly are building the housing that we need for luxury and high-level housing, but we are not building the housing that we need for low and moderate income communities. And that causes the housing that we do have to be more and more expensive. Unfortunately, we have currently housing only for the highest bidder. The only housing we have mostly is the housing that goes to the person that can pay the most. It's like an auction. I was thinking about it, and it's sort of like what healthcare must have been like in the United States before we had Medicare and in California, Medi-Cal, right? Where there was no intervention by the government. There was no way that the state or the federal government was making it accessible and easy for people to access healthcare. And that is what we need for housing. We need housing to be it is a human need. And the same way that we treat healthcare and that we're fighting for more people to have access to healthcare or water, clean water, utilities, we need to think about housing not just as a commodity, not just as something that is bought and sold between people and you can make money off of it, but we need to think about it as a common good, something that everybody needs to belong and to have a place to be a part of a community. So I really appreciate having the opportunity to join you all here today. Thank you so much.
Thank you, Francisco. We appreciate you participating in this panel and talking to us about this important issue. And we're going to ask all of you to get ready because now is the time we're going to go into a couple of the questions for each one of you. We're going to start off with Bambi. Tenemos una pregunta para usted. What investments need to be made or what policies are needed to improve the health of the trans Latina community?
Well, I mean, I think what needs to happen really is an intentional investment in the lives of trans people, right? Particularly when it comes to trans Latinx individuals, and even further, those of us who are immigrants, right? I think we need to understand the multiplicity of issues that specifically trans Latina immigrant women face in our society. And so, you know, we need to be able to provide economic development for our community. And one of the policies that we need to actually push for with ICE or Homeland Security and all of those individuals who make immigration policy is, you know, for trans women specifically to be able to provide some type of support when they're getting released from immigration detention when they have their cases pending, right? We know that, you know, because of the advocacy efforts that we do and because everything that is happening with our immigration system, some trans women are being released from immigration detention and have cases pending, but they really are coming out to nothing, right? Like oftentimes they don't have family members. Here in the United States, we often become their families, but they have no type of documentation for them to be able to obtain legitimate employment. And so we need to be able to support these individuals so that we can get them away from the recidivism of incarceration and ultimately immigration detention, right? Because we know that when our people are pushed into engaging in the street economy, that's a way for us to continue to be engaged in this recidivism process for us to continue to be incarcerated and then ultimately end up in immigration detention. And so, so there's a lot of things that need to happen, but I would say the most important is to really invest in the lives of trans people, particularly those who are immigrants, and invest in organizations who are doing this work, right? And I'm not just going to say our organization, but there are multiple organizations across the United States who do amazing work. But of course, if you can support the work that we do as an organization, please support us. We support people, trans women who are in immigration detention. We send them commissary money. If you want to sponsor a person, if you can donate $30 per month, it's $1 a month, and you can sponsor a person who is inside immigration detention with some commissary money. So, and there's multiple ways. So please go to our website and support our work. Thanks.
There we are. Thank you very much, Bambi, for that. And the following question will be for Brian and Jesus. This is a question for both of you. How can we better integrate youth into advocacy efforts throughout the whole state? Gentlemen, if you can't hear me, can continue with the following question. How about we go to Veronica? Okay, Veronica, in your perspective, how can we better integrate Latinx and rural communities into environmental justice policy and also systems change? We know you can answer that quite well.
Thank you. Yeah, a couple of my fellow panelists have already said this, is we need to meet people where they are. It's not about going into a community and telling community what to do, what the solution is, how to engage. Is in our work, we meet with communities on a regular basis. We host regular and ongoing community meetings in communities to identify the issue, to prioritize their issues, to develop advocacy and strategies to advocate for their priorities. And it really comes down to relationship building and trust. And it can't be transactional. So I really want to sort of emphasize the importance of that. So for example, we don't work on immigration justice issues. So we don't provide, that's something that comes up a lot in the communities where we work around access to an immigration attorney or access to resources. And we, as an organization, we don't say, sorry, we don't work on this. We say, we don't work on this, but we're going to connect you to an organization or somebody that we know and we trust, and make sure or invite them to come to your community to talk about these issues, to answer questions, and making sure that you have the community's back. I can't sort of emphasize the importance of building that trust and relationship. That's what it comes down to. That's organizing 101, and making sure that you're listening to communities, that you're not extracting and sort of operating from sort of in the same way that sort of we extract and take so much from communities, and Black and Brown people in particular, all the time. And that, I think that connected to the fact that our communities have had to be resilient for so long. And environmental justice, climate resiliency, those may be terms that we use in the movement work and policy in discussions around advocacy, but communities have been fighting for survival for so long. They know what it means to be resilient. They know what it means to take care of one another. We saw that through the COVID response. We saw communities, especially in rural areas, mobilize much more quickly and much more effectively than local public health departments did, to make sure that people were protected and weren't dying because of the lack of inaction and protection provided by decision makers in communities where we work. So, it comes down to building trust, building relationships, not being extractive or transactional, and really listening to the expertise, wisdom, knowledge, and skills that exist in communities, and making sure that is what leads our work as a collective.
Okay, thank you very much, Veronica, for that. We're now going to go to Francisco. I know you're right there paying attention, Francisco. So we're going to ask you the following question. What policies can improve tenant protections and also increase access to affordable housing for Latinx communities?
Thank you, Leonora. I'm sorry I didn't take off my camera while Veronica was speaking. I think, I would echo what Veronica was saying, that in addition to the policies, I do want to point out that we definitely need the outreach and the education. A lot of folks do not know their rights. For example, as tenants, a lot of times when a landlord even tells them, hey, I'm going to evict you, many times families will move as soon as they hear that, even before a landlord brings an eviction notice, because they don't want to go to court. They know they think they can't afford an attorney, and they don't know their rights. So I think one of the bills that we are fighting for at the moment is called AB 1487. We're asking the governor to sign it. This would create a statewide fund for eviction prevention and defense. And that's really important, because if we can't get to families when they're still housed, then it will be harder for us to prevent them getting kicked out into the streets or becoming homeless. So I think that that's one of the places that we definitely need to do more work around, the outreach and the education, along with the legal services. And then the thing around affordable housing, truly affordable housing, many of our coalition partners across the state are talking about and thinking about what is called social housing. Social housing is something that is done in many parts of the world, whether we think about Europe or even Latin America and Mexico, where the government has a very strong role and intention to provide housing in many different ways, so that it's actually affordable and accessible to communities and meets them where they're at. We have in our data around housing, we say any tenant who pays more than 30% of their income to their rent is housing burdened, is rent burdened. That is a data point, a measuring stick. But we don't have housing, we don't have an alternative for them. We don't say, okay, you're rent burdened, now we have a cheaper apartment for you so that you won't be rent burdened. And that's where we need to go. That's where we need to head. So social housing is something many groups are starting to explore and promote.
Very much, Francisco. We appreciate that. Let's see if we can go to Jesus. There you are, Jesus, and maybe Brian can also jump on. This question is for both of you. You can start off, Jesus. The question was, how can we better integrate youth into advocacy efforts throughout the state?
Oh, okay. I think it would start with people in positions of power, allowing our youth to be able to step into these spaces. For example, like here locally in Alameda County or Oakland, we've been pushing and fighting tooth and nail to get some of our formerly incarcerated youth to be able to join these committees and subcommittees to be able to speak and share their experiences, because it doesn't make sense for any body of people to make decisions on experiences they've never personally experienced, right? I mean, they may have a lot of research, they may have a degree, and all these things are great and it helps, right? But we need somebody from our community that we, advocate for and support and has been through the system to be able to speak, especially young people. We always tell young people that they're the future, they're the leaders of tomorrow. But when it comes down to, putting our money where our mouth is, I feel like not every person in positions of power allows young people to be in these positions, so it definitely makes us look back at our leadership and be like, which one of you are willing to not only advocate for young people to get in these positions, but like support them. And then us as community folks, we got to educate them on policy. Policy has its own terminology, its own language, It can be very complicated for adults. So imagine a youth who's experienced poverty, who hasn't gotten the best education due to financial reasons and has been incarcerated and has to deal with healing and PTSD. And we got to meet them where they're at. I feel like here at Courage, we definitely do that. You see if they need help with housing, or do they need a secondary job? Because they get paid to join the workshops that we do here. We teach them about, like, you know, getting involved with policy. We also teach about like some history. We talk about the system. And then we also have fun too. We do community events, let them be engaged, and we have a community garden. It's like a holistic approach. Everyone, they can play their own role, whatever like you can offer, contribute, that can be a contribution for the young people. But we all, as a whole, as a village, we got to invest into our young people, especially if we want to get them to the state level. It'll start locally, and as they move up and they get a little older, we push them to, you know, be able to speak at the state level, because I'm all for it. I would love to see some of my youth be able to like hold a seat. I've seen them go to Sacramento and speak at that level, but like to actually hold a seat or to have like a youth board or some kind of subcommittee, I think that'll be great. Thank you.
Thank you very much. That is very inspiring to hear how they're evolving and growing through that education. Thank you, Jesus. Brian, I don't know if you were able to catch on to the question.
Yeah, you can repeat it, but
You want me to repeat it?
Yeah.
You're gonna put me on the spot. Let's see. Let's see if I have it.
I heard it.
Here we
I
go.
heard it,
No,
but
I'm just kidding. I've got it. How can we better integrate youth into these advocacy efforts throughout the state?
How can we integrate them? Like, man, Sue said them best, just thinking about them first, like, because like way most of the youth live in the communities, you know, and I feel like the main people that make decisions is not like way in the communities that, you know, that they're making decisions on. So therefore, like, if we just give them the proper knowledge, just like Sue said, they could be in the platforms to where they know about what's going on in their neighborhoods, and like just knowing about some of the gentrifications instead of it just hitting them different. And now their communications and get or have cases, or like just the police is just around more, just the fact that they're not knowing because they're not in policy meetings, or just not, or bill meetings, or, you know, or any, don't know anything about any legislation. And like, I'm a prime example of Courage just investing in the youth. Like, I started around like when I was 17, just working up in the woodworks of life coaching and diving into policy work, just learning about legislation and learning about how I myself can prevent from running into the police, you know, encountering them, and then just being in a position to where I can teach people around me to where this is what we're focusing on, this is what we can learn, this is what you can be at, to where you can grow. And if you see yourself learning about laws or any type of policy, then we have a position for you. Like you said, Courage, like all fellows here, like I feel like just take steps to where we all might be in different counties, but like they all are from Oakland. So it's like they see a change in their neighborhoods and they want to like learn about it and learn why it's like that and try to make a difference. So I just feel like just trying to just propose opportunities to them to where like this is what we have for young folks, to where this is what y'all can learn about. Because I feel like we don't get this in school. And I feel like a lot of nonprofit works can teach that for us if we just invest in them. So thanks.
Thank you, Brian. We have a question. Let's see who wants to answer this one. This is a question from a physician in the Central Valley. How can healthcare providers get involved in these issues? LGBTQ rights, criminal justice, housing justice, environmental justice, from a physician in the Central Valley. Who'd like to jump on it? Veronica, I see you turned on your camera.
I'm happy to jump in and just say really quickly, you know, reach out to community-based organizations, including those on the screen and on the panel today, to learn how to be engaged, how to be an ally. Welcome the opportunity to work with you in the San Joaquin Valley. We're based in the San Joaquin Valley, and you know, every voice and allies are needed in our work. So I would say start by reaching out and to community-based organizations doing work in these spaces.
Anybody else interested? Go for it.
I I think I agree with Veronica. Just reach out to the organizations and see how you can help. But I think a good example that we have here, like I work in Oakland, but I'm from San Francisco, so I'm kind of like all over the Bay. We have a coalition called the Do No Harm Coalition, and it's a coalition of doctors and healthcare providers and physicians with white coats. And I remember it stuck out to me because, you know, I'm like from the streets activist, and to see lawyers and doctors step into our pounds, there was a group called the Frisco Five, and it did a hunger strike for 17 days in front of the Mission Police Station. And then we had the Do No Harm Coalition, the doctors come and support and like help take care of them like for free, and take them to the hospital when they needed them, and also speak to the politicians, let them know this is happening to these people's bodies as they're going on hunger strike. And then when we marched from the police station to City Hall, they were like behind them and pushing them in their wheelchairs because they were so weak they couldn't even walk anymore, you know. That always, like, I'm a photographer, so that always resonates in my mind, like to see that. And I'm not saying that's what we expect out of like physicians, right? But like they said, reach out to the local organizations doing the work that are involved and see how you can get involved, whether it be through like your skills as a physician or doctor, or maybe something else, because we're all human. We could pay contributions in a different way. But yeah, Do No Harm Coalition, that definitely the first people that came to mind.
I would just like to add really quickly that I think there's a level of humbleness that needs to happen between, you know, different structures and different people who, you know, have degrees. In this case, you know, doctors, for instance, you know, oftentimes, you know, it has happened to me, for instance, you know, like I've gone to the doctor and suggested things that like could potentially support me, but then, you know, the doctor says like, well, who's the doctor, right? And so I think there needs to be like a level of mutual collaboration that needs to happen, and there needs to be you know, like a level of humbleness that needs to happen from these structures, you know, that have told us that they are superior than many of us, right? And you know, many of us, you know, do grassroots level work that oftentimes individuals like doctors, lawyers, and individuals like that are super disconnected, right? Because there's, you know, they have a level of privilege that they cannot ever understand. So I think, you know, just having this open mind, open heart type of situation with the level of humbleness would definitely go a long ways.
We're almost getting to the end of this panel. I'd like to see if everyone can give us, you know, maybe a closing statement, a minute or so. Francisco, do you want to start us off with that?
Yeah, thank you so much, Dinora and LCHC. I just wanted to, besides thanking everybody, also remind you that, like Veronica said, we're still in the pandemic, and many families might be struggling to pay their rent. And in California, we actually have billions of dollars for rental assistance. So folks should definitely look up Housing is Key, Google it, call that number, and they will connect you where you need to go to be able to access that information. It won't affect your taxes or your immigration, any immigration proceedings that you might be in, but it will keep you housed. So that's important to know.
Thank you, Francisco. Bambi?
Yeah, well, I just want to once again express my gratitude and appreciation for, you know, for allowing me to be part of this session and for the incredible information that was shared. And, you know, I've been doing community work for over 25 years, and, you know, hope is what has kept me going, right? And so I want to encourage for all of us to obviously know that there's a lot of work that needs to happen, but I believe that we will win, right? Like we say those chants when we do actions and all of those things. And so to me, it's about believing that, you know, that we are creating a world that is going to be a better world for all of us. And so I want for all of us to continue to be hopeful and continue to push unapologetically to change the structures that continue to marginalize us. So Thank you so much for the opportunity to be here with all of you.
Bambi, Jesus, Brian, and then we'll go to Veronica.
No, yeah, thank you. I just want to take the time to highlight some of the names of who's been victims of police brutality, because we've been speaking about them, and they're humans. They were here. They have families. So as you can see, I have Alex Nieto, rest in power, from San Francisco, killed by SCPD. Michael Cortez, Mario Woods, Jessica Nelson, Sean Monterosa, Luis Gongora, Kenneth Harding Jr., Derek Gaines, just Oscar Grant. And it's real sad, and it's a long list. And I want to take time to say all their names and to, we get justice for them. It's a lot of grassroots organizations. I'm involved with a lot of it, and they matter. They're important. They mean a lot to us. And I don't want to wait for it to be someone else that was close to me. So that's the drive that pushes us to continue fighting and being out there and being vocal and unapologetic, just like Bambi said. So thank you.
Thanks. I just want to say thanks for having me too again. Just talk about some healing aspects, just far as like saging. Like I feel like sage can just help. I didn't believe in that at first, but I feel like just the smells and just being outside with it, playing around with it can help, and growing it, and gardening too can help as community healing. Like we have a garden at Courage, a community garden, to where we transformed it, and it started from the gangs junctions where Courage took over, and it took empowerment to where it's owned from the city still. Like we don't own the property, but we just transformed it into a beautiful garden, and that right there just helped, because the soil is just our ancestors. So like it's just digging into our roots and blossoming up some. So I just want to talk about just healing work. And thanks everybody for speaking too. I appreciate it.
Thank you, everyone. Like everyone else has said, I too want to express my gratitude to being here and sharing space with my rockstar panelists today. I last thing I'll say is just, let's not underestimate our power as a community to lead, as a community to win, and as a community full of heart and grit that really can create the opportunities that we want to see in all of our communities. Thank you.
Love that. We did have rockstar panelists today, so thank you all very much for participating. One of the things that caught my attention, just to conclude, and it said, empower people to help them advocate for their peers. Be community warriors was what Jesus mentioned. And, that means working together. And this is perfect proof of how working together can bring positive change in the community. So I wanted to thank all of you, all of our panelists, for participating. And of course, for our audience who's also participating and listening in, we want to ask all of you to please stay tuned for our final session of the summit. It's up next: Policy Solutions and Health Systems Transformation Toward Health Equity and Racial Justice. Thank you so much. Welcome back, everyone, to our second and final panel of the day. I hope you are enjoying your morning and now your afternoon. And for those of you who are just joining us, my name is Dinora Perez. I'm a news reporter with Telemundo Los Angeles, and it has been a pleasure being with you guys today. We were together the last hour, and we're going to be together this following hour, and I hope you enjoy it. So before we get started, I do want to give you a quick reminder. This event is being streamed in Spanish, and it's also in American Sign Language. So if you need to access one of those channels, you can do so via the channel at the bottom of your window. So please do that now. Also, at the end of the panel, you'll have an opportunity to submit some questions to the panelists via the chat box on your screen. So be sure you indicate what panelists you'd like that question directed to. And of course, we're going to try to do our very best to combine and get to as many questions as possible as we can today during this 1 hour. So now we will focus our conversation on current and future policy solutions to address health equity and racial justice. To get us started in this important conversation, we have the honor of welcoming Rhonda Smith. Good afternoon, Rhonda. Rhonda currently serves as the Executive Director of the California Black Health Network. She previously served as the executive director of the Life Serve Youth Foundation and as the interim executive director for integrative medicine for the underserved. She also has prior experience in health disparities, consulting experience. Rhonda worked in sales, marketing, learning, and development, consulting, and business management with various companies. She also earned her MBA in marketing and operations management from the Colgate-Darden School of Business at the University of Virginia, and her bachelor's degree in civil engineering from Virginia Tech. So welcome aboard, Rhonda. Thank you very much for joining us. We'd like to hear your initial remarks.
So thank you, Denora, and thank you to LCHC for the opportunity to be with you all today. And so at the California Black Health Network, we work every day to advance health equity for African Americans and Black immigrants here in California. And we do that kind of at the individual, system, and community level. And so we are part of a coalition and a co-sponsor of the California Health Equity and Racial Justice Fund, because it's so important to invest in community-based organizations. And the reason that's so important is because we need to reduce really unfair and disproportionately high rates of preventable illnesses and deaths from occurring in communities of color. And also we need to find ways to transform our communities so that the institutional and structural barriers and systems that promote racial injustice are mitigated or hopefully eventually eliminated. And so when we think about power building and really focusing on enabling those who do the work every day that are on the front lines to actually have an impact, it's important to provide the proper resources and support that is more focused on sustainability. We know a lot of us who do community-based work see support, financial support in particular, come and go, but we really want to see investment that supports and encourages and drives lasting change for community-based organizations. And we know that often when we look at BIPOC-led organizations compared to maybe more mainstream organizations, there's also that philanthropy gap in terms of the level of funding and support that we often receive. So that's another reason why the fund is so important. And we also know that a lot of what I often say is health really happens outside of the four walls of any healthcare center or healthcare institution. And so when we talk about structural, dealing with structural issues and going further upstream, that is an important element of what this particular fund will address. And then also, we know, unfortunately, that often at the root cause of a lot of injustices is racial bias and racism. When we are seeking healthcare, those from communities, underserved communities, and those from communities of color are seeking healthcare, that is often an issue or challenge that we are confronted with or we experience. And so really focusing on sort of the root causes, whether it's institutional, structural, or other, is an important part of really seeing at least what we want to see is a healthier California for all, but definitely a way to advance health equity. And so community-based organizations, again, those that are actually doing the work every day, need to be supported in order to have that impact and see the lasting change that we need to see in our community so that we can improve life expectancy of all Californians, and especially those of color, and see better outcomes. So.
Thank you very much, Rhonda, for participating in this panel. And up next, we have Kiran Savage Sangwan. Kiran is the Executive Director of the California Pan-Ethnic Health Network, CPEN. CPEN is a statewide multicultural health advocacy organization focused on eliminating persistent health inequities and also addressing structural racism in healthcare. Kiran has a background in immigrant and mental health organizing and advocacy. And prior to joining this organization, Kiran also worked as a director of legislation and advocacy for the National Alliance on Mental Illness in California. Kiran graduated from New York University with a BA, a bachelor's, and a master's of public administration. She lives in Sacramento, California with her spouse and daughter. Bienvenida. We welcome you, Kieran. Thank you very much for joining us. The microphone is all yours.
Thanks so much. It's really great to be here. I appreciate the invitation today from my friends at LCHC. I'll just say another word about CPEN and who we are. We, as you said, are a multicultural health advocacy organization. And we were actually founded in 1992 by 4 organizations who had this vision that in order to really advance health equity, we needed a space where different communities collaborate and stand in solidarity with one another. And one of those 4 brilliant organizations was LCHC. And so I'm really always thrilled to be part of your events. And so, you know, we do a lot of work looking at health inequities. People often refer to them as health disparities. And one of the things that we think is that, you know, these inequities that we see in communities of color, and particularly in the Latino community, they're not a surprise, they're not a coincidence. They result from the way that healthcare is designed to be exclusive, to be fragmented, and to be centered on the needs of payers and providers rather than on patients or on people. And so we think about equity and health equity as being fundamentally about power, and thinking about how can we shift the balance of power in healthcare delivery so that we really center people, and particularly the people who have been most excluded from our healthcare systems, right? People of color, people with low incomes, LGBT people, people living with disabilities. And so, you know, in California, we're at a place now where we don't have everybody covered, right? Not everybody has health insurance. And so we do need to keep focusing to close that coverage gap. But we also have a lot of people covered, right? And so a lot of what we think about now is, what does it mean to actually have health and have health care beyond that insurance card, right? And what else does it take? And so we collaborated with LCHC over the last couple of years on a big project where we sort of went out, we talked to communities, and we thought about, starting from where we are today, how do we really innovate and transform healthcare delivery so that it works for people of color? And so I'm just going to share like a couple of the top lines from that. I know we don't have a lot of time, but I think, you know, really part of our model is working with community and is hearing those experiences, but also really bringing community to have their own voice at the table. And so part of what we really heard and what we think is necessary in terms of transformation here is really thinking about, you know, healthcare. We have a lot of different ways to change it. And one of the biggest ways to change that is to think about what we pay for as a society, right? And making sure that we transform to a system where we have universal coverage, where everybody is in and nobody is out, right? But that also we really use our dollars to focus on transformative change that reduces racial disparities in health outcomes, right? The other thing that I think is really important that we hear a lot is, how do we strengthen culturally and linguistically appropriate care? We have a huge body of research that tells us that there's greater satisfaction among patients and better health outcomes when you have a culturally concordant provider, right? When you have someone from the same community who understands your cultural background, particularly who speaks the same language that you do. Yet we really have few Latino physicians, and particularly Spanish-speaking physicians and other healthcare providers in the state of California. So really looking at how do we broaden this healthcare workforce and how do we diversify this healthcare workforce is going to be key. The other point I just want to touch on is really thinking about, you know, health is not just your primary care, right? Your head is attached to your body, and so your mental health care is a really important part of your overall health. The other important thing about your head is your mouth is a part of it, right? And so your dental health care is a very important part of your overall health. And so we are really focused on dental care, because if you look at some of the staggering disparities for Latino kids and for Latino seniors, that's where we see some really huge issues. And, you know, it relates to your ability to be employed. It relates to your ability to eat and have proper nutrition, with Betsy can tell us all about, right? And so we're really focused on how do we strengthen that access to oral health care for all of our communities. And there's some exciting federal opportunities that I'm happy to talk about later, but want to pass the mic to my colleagues.
Thank you very much, Kieran. I love your enthusiasm. We're going to have a really great panel today. Up next, we have Betzabel Estudillo. Welcome, Betzabel. She's a senior advocate for Nourish California, where she oversees the organization's Food for All campaign to increase food access among immigrant Californians. She has more than a decade of experience in immigration, health, and public benefits, working in the nonprofit and labor sector. Her areas of expertise include policy development and analysis, legislative and budget advocacy, coalition building, and community outreach. Betzabel obtained her master's in social work from the University of California, Los Angeles, Luskin School of Public Affairs. In her free time, Betzabel enjoys hiking, coffee, watching horror movies, and spending time with her family. I like everything but the horror movies, but we're still going to welcome you. We're not going to take that against you. Thank you very much for joining us, Betzabel. The microphone is also now yours.
Thank you. Thank you so much. And of course, my favorite time of the year is coming up, which is Halloween. So, very excited for that. But thank you so much for that introduction and opportunity to speak in today's panel. And we've had a very close and long partnership with LCHC and their team. And so I'm really excited to be here. As mentioned, I'm Betzabel Estudillo. I also go by Betsy, and I'm with Nourish California. For those that don't know about our organization, we are a statewide policy and advocacy organization that focuses to improve the health and well-being of low-income Californians by increasing their access to nutritious and affordable food. So we work on a number of advocacy issues, and one of them specifically is around immigrant access to nutrition benefits, which is our Food for All campaign. So before I talk about Food for All, I really just want to give a little bit of background around this issue and why we're specifically advocating for immigrant access to nutrition benefits. So I think as we've been talking about in these last 2 days, the pandemic has continued to impact us all, but specifically for Latinx and immigrant Californians, they face higher risk of COVID-19 infection and death because they're often working on the front lines, either in agriculture, in our grocery stores, in restaurants, or other industries that supply the food that we need. That pandemic has really worsened the hardship of immigrants across our state, many who are locked out of our most economic relief, including our CalFresh program, which is actually one of the most powerful anti-hunger programs that we have. To share some data and give some more light to this issue, as of January 18th of this year, we saw that about close to 23% of California households were experiencing food insecurity, and the rates of food insecurity are even worse when you're looking at race, with about close to 25% of Black households and 33% of Latinx households reporting some levels of insecurity. So definitely a disproportionate rate of food insecurity among our Black and Latinx communities. This is why we kicked off our Food for All campaign this year. And this has been years in the making, honestly. This idea was brainstormed or put out there many, many years ago. Our partners at the California Immigrant Policy Center have always, worked with us on this issue. And we were finally able to kick it off this year with the introduction of SB 464 by Senator Hurtado. And we were also able to include a budget act as well. So what does the Food for All campaign do? So what it looks to do is to modernize our CalFresh program and another program called the California Food Assistance Program to provide nutrition assistance to all immigrant Californians who are currently excluded from CalFresh due to their immigration status. And most of those immigrants are actually undocumented immigrants. We believe there should be no exceptions and no exclusions, especially now in our state of California, where we've made bold policies in making our state more inclusive for our immigrant communities. And we were actually very successful this year, thanks to our co-sponsors, the California Immigrant Policy Center, our Food for All Coalition and partners, and our team and legislative leaders. This year's state budget includes $30 million in funding to begin the implementation of Food for All. So we're very excited about that budget investment. We're very proud of this bold step. California is actually the first in the nation to begin to provide nutrition benefits to all immigrants, regardless of immigration status, as long as they meet the income requirement. And we will continue to advocate. We know that The 30 million and a part of those 30 million includes some funding to begin to provide direct benefits. We know that's not enough. We know that we need to make sure that all of immigrants that are excluded have access to those benefits. So we'll continue to advocate for this issue next year, and we look to partnering with LCHC and many others here that are joined us in the summit. So thank you, and I'll hand it back to our moderator.
Thank you, Betzabel. We appreciate you participating with us, and we're also now going to welcome Gabriela Barbosa. Gabriela is the Managing Director of Policy at the Children's Partnership, where she leads the development, implementation, and supervision of a multi-issue advocacy agenda focusing on advancing systemic changes that protect and also promote the well-being of children from historically marginalized communities through public policy, research partnerships, and also community engagement. Gabriela has a decade of experience using various advocacy strategies to achieve a more just and equitable society for children. She received her bachelor's in political science and human rights from Columbia University and also a law degree from Columbia Law School. Gabriela is a proud daughter of immigrants, and we now welcome you, and we hand you the mic so you can give us your opening remarks. Gabriela.
Thank you so much. And thank you so much for inviting me to be part of this panel. It's really such a pleasure for me, especially being the first generation of my family to be born in the United States and someone who proudly identifies as Latina. So again, the Children's Partnership is a statewide California-based children's advocacy organization dedicated to protecting and improving the health and well-being of children from historically marginalized communities. We at the Children's Partnership believe that in order to reach health equity, or a society where everybody has a just and fair opportunity to be as healthy as possible, we must also consider and prioritize the health of our children. Childhood is the foundation of all growth and development, lifelong health, and future well-being. Investing in children is among the strongest investments we can make to reduce high rates of death from preventable diseases impacting historically marginalized communities of color, including Latinx communities. We also understand that a child's health is largely tied to the conditions that surround their lives and that ultimately shape their life trajectory. This is why our work not only looks at a child's physical and mental health, but also the conditions that exist where children live, learn, develop, and play, and the social, political, environmental, and economic factors that shape those conditions, including intentional and unintentional racism, otherwise known as systemic racism, xenophobia, poverty, and discrimination. So in order to help guide our work and provide a snapshot of our state's children and their health, we developed a series of fact sheets that we update annually with data across various indicators like healthcare coverage, mental health, COVID-19 cases, deaths, and vaccines, food and housing insecurity, and more. Each fact sheet that we have released is focused on a specific child and youth population from communities who have faced and continue to face oppression and discrimination, and who have historically not been centered in public policy making or health systems, including LGBTQ youth, Black children and youth, Native American children and youth, Latinx children and youth, and Asian American children and youth. The data in these fact sheets clearly show that disadvantage, discrimination, and racism have accumulated over time in the form of systemic barriers to good health and well-being that disproportionately impact children from these communities. So this month, as part of Latino Heritage Month, we partnered with the Latino Coalition for Healthy California to uplift the inequities that Latinx children in California are facing that shape their success and healthy development. And I would like to share actually this fact sheet with participants. I just dropped it in the chat because I'll just quickly be going over some data highlighted in that fact sheet. So starting with demographics around who are Latinx children in California. Latinx children in California make up a majority of our state's population under 18. 52% of the state's children identify as Latinx, translating to over 4.6 million children in California. But these children are not a monolithic group. They represent a diverse population that includes an array of ethnic and racial identities. About 1.8 million Latinx children identify as mixed race or multiracial. About 36,000 identify as Black and Latinx. 44,000 identify as Latinx and Native American, and 27,000 children in our state identify as Latinx and Asian American. Nearly all of these children, or 96%, are US citizens. But most of these children do rely on adults who are not citizens, who live in mixed status families where at least one of their parents or guardians is a non-citizen. Over half of California's Latinx children have at least one parent who was born outside of the United States, and about 25%, or a little over 1 million Latinx children who are US citizens, have non-citizen parents. So quickly going over some physical, mental, and oral health data impacting Latinx children. So Latinx children are facing a number of challenges when it comes to their health. About 214,000 Latinx children in California still don't have health insurance coverage. Nearly 1 in 3, or 1.5 million Latinx children, don't have health insurance coverage that is continuous or adequate for an entire year. 874,000 Latinx children did not receive a preventive checkup last year that helps to detect or prevent serious diseases and medical problems before they become major. And only a quarter of Latinx children in Medi-Cal have been screened for risk of developmental, behavioral, and social delays in the first 3 years of their life. And these delays might interfere with expected growth, learning, and development. We also know, as others have mentioned, that Latinx children have been disproportionately impacted by COVID-19. They have become infected and have passed away from COVID-19 at higher rates relative to their representation in the population. And strikingly, with Black children, Latinx children make up an overwhelming majority of children who develop multi-system inflammatory syndrome in children because of COVID-19. And as Kieran mentioned, when it comes to their oral health, Latinx children are impacted by the highest prevalence of tooth decay compared to their peers, with more than 72% having experienced some form of tooth decay compared to only 40% of white children. They also have among the highest prevalence of untreated tooth decay, with 1 in 4 Latinx third graders in California having tooth decay that has not been treated. The last thing I'll mention from the fact sheet, and it includes a lot of really amazing data that I hope you check out, is around mental health. Latinx children and youth are facing severe mental health issues. They are dealing with higher rates of depression and suicidal behavior compared to their peers, but they're also less likely than their peers to actually receive mental health treatment to address those issues. Overall, over 1 in 2, or 50% of Latinx teens in our state have felt chronic sadness or hopelessness in the last year. And Latinas in particular are facing the greatest inequities when it comes to their mental health. 62% of Latina teens in our schools have felt chronic sadness or hopelessness in the last year. 34% of Latina teens have considered suicide, and 13% have attempted suicide. For lesbian, bisexual, and queer Latina youth, the reality is even worse. Nearly half have considered suicide, and 1 in 3 have attempted suicide. Yet alarmingly, despite these mental health issues that we clearly see in data, in California in the last year, 75% of Latina teens did not receive psychological or emotional counseling to deal with these issues. The last thing that I'll touch on before I end in my public remarks is a priority that we're trying to pursue to help address these issues. And that's really uplifting a community health workforce, and specifically promotoras and CHWs and community doulas, to address and improve the conditions that shape child health and well-being. And right now we're actually part of a state work group that is creating a benefit for community health workers in our state Medi-Cal program. And we are really pushing for the state to create a dedicated community health worker and promotora benefit for all children in Medi-Cal to provide preventive services around oral health, other health services, and addressing some of these conditions that I mentioned that are really impacting and shaping child health, specifically Latinx child health. So I'll stop there.
Very much. That was quite a lot of information, and it shows there's a lot of work to be done. So I thank you, Gabriela, for being a part of this panel. And we're going to start now with a couple of questions for our panelists. We are going to see who can answer these questions. So if you feel you want to begin, just raise your hand and we'll go to you. But let's get started with this first question. What were missed opportunities in this year's budget and legislative process? Rhonda, do you want to get started with this one?
Hold on. Yeah, so we were really hoping that there would be funding support for the Health and Racial Equity Fund this year. Unfortunately, it is pushed into the 2022-23 budget cycle. So for me, that was a missed opportunity because I think, you know, with the funds that were available in excess for this year, it could have been an opportunity to really get some traction and more movement and having an impact at the community level to really address some of the structural and systemic issues that exist that really drive health disparities. So for me, that was a huge missed opportunity.
Thank you. Kieran, would you like to answer that one as well?
Sure, absolutely. I mean, I totally agree with Rhonda, and just to contextualize for folks, the state budget this year, you know, there was a tremendous opportunity to advance equity. The state budget is flush, and mostly because of economic inequality, right? The rich have gotten even richer during the pandemic. And so I think the state budget itself could be an opportunity to try to equalize that, right? And to try to really build our safety net and support our families who are working, our families with low incomes, et cetera. And there were certainly, I think, really significant achievements in the state budget in that regard, but there were missed opportunities. I agree with Rhonda about the Health Equity Fund. I also think on the worker piece, you know, there were many wins. We saw big wins, I think just yesterday for garment workers, right? But we did leave on the table paid family leave, making that program work for people with low incomes, right? Making it possible for people to take time off work when they have a new child, when they have a sick family member. Also supplemental paid sick leave, which has been really important during the pandemic so that people stay home when they're sick, so that people know that if they get vaccinated and they have a reaction, they have paid time off. We left that on the table too. Some issues around supporting farm workers. So I think there was a lot more that could have been done also in the worker piece. And then the final piece I'll say is on the health, what I call the health industry accountability issues, right? Like how do we hold all these companies accountable for really providing healthcare? We didn't get that far. And I think given what we saw in the pandemic, really with the grave inequities that we had, I wish we would have gotten farther on that this year.
Gabriela, do you want to talk about the missed opportunities?
Sure. There's only one thing that I'll focus on. Last year, we were pursuing a policy change to address administrative burdens that children and families experience when both enrolling into health coverage and also keeping their health coverage. And we were trying to promote a policy of uninterrupted, continuous Medi-Cal health coverage for all children until they are 5 years old in Medi-Cal. And that proposal was included in the legislature's proposal, but unfortunately did not make it in the signed budget. But we have really highlighted addressing administrative barriers as a key issue in promoting health equity. We want to make sure that we're pursuing policies that make it as easy as possible for communities to access benefits that really support their livelihoods.
Thank you, Gabriela. Betsabel?
Yeah, I'll just quickly add, I mean, I think as it's been pointed out, there were definitely some really great investments made in the state budget and some really great bills that were signed this year. But I will say one really missed opportunity was not signing or investing in emergency food assistance for undocumented immigrants who have been disproportionately impacted by this pandemic. So this would be AB 221, authored by Santiago, did not move this year. It did not move last year, similar bill. So I think it's just a really big missed opportunity to providing direct benefits that would have helped people today. Yeah.
And let's go a little bit deeper. What do you guys think? What are some of the key issues or priorities for your organization's budget and policy agenda for next year? Do you want to get started, Kieran?
Sure, happy to. So I would say number one, what a lot of us refer to as finishing the job on coverage, right? Because we still have an exclusion from the Medi-Cal program for people who are sort of in the middle range of their lifespan, right? still excluded from our Medi-Cal program, even though we made great progress on people over the age of 50 this year. And so I think that's a really important part on getting to universal coverage in the state of California. There's also some other things that we need to do around that. So, finishing that job on health coverage. I think the second piece I would say is a priority for us is these issues around really providing a strong system of culturally appropriate, both behavioral health care, so mental health care, and care for substance use and addiction disorders, as well as dental care, which continues to be a huge area of need in communities. And then the third piece that's really a big priority for us is this issue about really transforming the delivery of healthcare so that we are identifying where we have racial disparities so that we have much better data and that we're able to act on those by really, I think, exercising greater oversight over our health industry players.
Very interesting. Thank you, Kieran. And some key issues for your organization, Gabriela?
So there are a couple of things that I'll mention. One thing isn't directly related to budget and policy priorities, but one priority that we just have as an organization right now is ensuring that families know about the resources that they can access through the American Rescue Plan Act and through our state budget that was passed this year. And I just dropped a parent checklist into the chat that is available in both English and Spanish. And if it can also be shared with attendees, it has essentially the COVID-19 rent relief program on there, supports around accessing high-speed internet, the Golden State stimulus, child tax credit. There's so much on there, and there's so many resources and programs that parents can access right now, but not a lot of outreach and education going on to make sure that they know how to access them. So that's one of our priorities, is definitely around ensuring families recover from the pandemic. Another one is focusing, and this is more related to policy and budget priorities. This is about increasing access to preventive services, like I mentioned earlier, that really prevent inequities and severe disease from developing later on in a child's life. And we're doing that through promoting continuous Medi-Cal coverage for children from birth to age 5, and by also advocating for the creation of a dedicated community health worker preventive services benefit that would be available to all children. And the reason we want to start early is because 90% of a child's brain development occurs between the ages of 0 to 5, so it's really important. Related to mental health is absolutely a priority in our organization. Our fact sheet highlights really alarming data around the mental health issues that Latinx children and youth are facing. So we're going to continue prioritizing policies that really expand access to mental health services, but also expand access to community-defined mental health services. We have a research project going on right now with a collective of youth from all over the country who are essentially creating their own mental health policy agenda, which will help shape our own mental health policy agenda in the next year. Another priority I'll mention is around shifting power as an anti-racist strategy. We're thinking a lot internally as an organization how to center better communities, children and families in our policy priorities and in our advocacy. And it's also something that we're doing in determining what kind of policies we are deciding to pursue. And that's why we're so excited about promotoras in a community health workforce, because we really see that as an anti-racist strategy to disrupt the power of the healthcare system, because promotoras really reflect the communities that they serve. They have shared life experiences, shared identities, and integrating community health workforce and promotoras into Medi-Cal really has such great opportunity to transform and shift power within our healthcare system. And then lastly, we are continuing to support immigrant and mixed status families. We do advocacy and support of coalitions like Food for All and Health for All, understanding that the health of children often reflect the adults that they rely on. And so we really want to make sure that all adults, no matter their immigration status, have access to public benefits as well.
Thank you, Gabriela. And some key issues for you, Betsabel?
Yes, I'll name a few, and I will say we're in the process of our developing our priorities for next year. But some of the things that definitely will be part of that, we'll continue to advocate for Food for All and making sure that we finish the job and that we provide nutrition benefits to all those immigrants excluded. We will also do some work around food access for our older adults in population. We've been doing some work to making sure that our seniors have better access to CalFresh, and that it's just a much more streamlined process for them. So we'll continue to do some of that work. There was also some really great investments in the state budget to providing meals in childcare centers. And so we will continue to advocate that and making sure that that funding is implemented in a very easy way for those childcare centers. And then, we've done some work around pandemic EBT, making sure that those benefits are received by children in schools who, were at home during the pandemic. And the implementation is ongoing, and we'll continue to be a stakeholder in making sure that those benefits that are still being delivered, that the children and families are receiving them in a timely manner.
Rhonda, you're up next regarding the priorities for your organization's budget and policy agenda for next year.
Yeah, I want to answer that question by starting out by saying that, those of us who do work in health disparities and health equity and have been doing it for a long time are probably a little weary of the fact that we're still talking about it and still dealing with this issue. And in some cases, especially in the Black community, it's gotten worse. And so when I think about, why that is, and all of the advocacy and policy work that CBHN has done in the past, a lot of those have focused on, making sure that people, and communities have greater access to quality, affordable healthcare. But for me, the thing that has been missing is policies that are focused at the system level that address some of the things that have been said by my colleagues here, that really address and try to dismantle some of the systemic things that exist within the system. And a lot of that stems from racial bias and racism and what people, again, experience. So for our priorities, we're going to have more of a focus on addressing policy and driving policy change at the system level. So if we are able to, take what's happened with SB 464, the perinatal equity bill, and see if that can apply to primary care, that's an opportunity that I think could be plausible for us. And just making sure that, we can do our part to dismantle the structural and systemic issues that exist for those, or at the system level for those providing care to people who are seeking care. That's kind of our general thinking around our policy initiatives for next year.
Rhonda, we appreciate that. And we want to remind our audience, you can still submit some questions and answers, questions for our panelists. We also have one from the audience. It's directed to Kieran, but it also says for any speaker to go ahead and jump in afterwards. The question is, how can we build solidarity among impacted communities to help drive the equity work that brings us all here today to these spaces of advocacy, particularly around issues of people with disabilities?
So I love that question. I appreciate the person who asked it a lot. I think that it's hard, right? I think it's really hard work to build sort of this multicultural solidarity, because we all have our own, I think, really stark needs, right, at this point in time. And I appreciate the question coming from the perspective of people living with disabilities, because none of us live single issue lives, right? And so intersectionality is really important for us to think about. So I think the first thing that we all have to be able to do is listen, right? Is listen to each other, is to learn from each other, understand that our experiences may be different, but where we need to go in terms of equity and justice is very much the same, right? And so I think listening and learning from each other. And at CPAN, we are trying to be really intentional about remembering that all of us live intersectional lives, right? And thinking in our work, although we're an organization that's focused on racial equity, how do we, I think, form powerful coalitions with the disability community, right? With folks working in gender justice, because that's really, I think, what our communities need and what our communities are about.
In fact, anybody else would like to answer that one?
So just to build on what Kieran said, I think when it comes to health inequities, we have more in common than we do, differences. And so across the board at the macro level, I think whether it's the LGBTQ community or AAPI or Black or Latinx, I think at the macro level, we all experience very similar things and there's commonalities there. I think when we look, kind of at the cultural differences, there are nuances there that may be different across the different cultures. But I think if we all kind of recognize that there's more in common in terms of what we deal with and what we face on a daily basis when it comes to health inequities and other inequities as well, then coming together to me really promotes power building and we can work together to have greater impact. And Kieran and I and Jeff and some of the others have come together around the vaccine hesitancy and issues and equity relative to that. So I'm happy that we all are connected and we do often come together to talk about how we can collaborate and figure that out and support each other in different initiatives. So I think doing more of that going forward will definitely have a greater impact.
Anybody would like to answer that same question? If not, I can go on to another one. Okay, we'll go on to the next one. We have the second audience question here, and this is for anyone who would like to answer it. How do you envision healthcare systems who have the power, and we're talking health plans and providers, playing an active role in addressing structural inequities? Who would like to get started? Isabel?
Oh man, that's a really challenging question.
If you want to skip it, we can continue. If not, the mic is all yours.
I'm happy. I don't know if others who actually work more specifically around access to the healthcare and working within and outside the healthcare system could answer that. I mean, I'm happy to, because I have also done some healthcare advocacy, but wondering if others wanted to go first.
I can.
Well, go ahead, Gabriella.
Okay. Thanks, Rhonda. Just really quickly, so we're actually working on a research project right now where we've been interviewing managed care plans across California to really see how they're engaging with community-based organizations and their own beneficiaries in addressing social determinants of health. And we see that it's not really happening very much. And one of the things that we are learning from this work is that health plans need to make it much easier for CBOs to contract with them and partner with them. It's often very, very difficult meeting all these different stringent requirements that come along with working with a health plan. And CBOs know and understand their communities better than anyone. Secondly is we really think that health plans need to engage their community members and their beneficiaries in a more meaningful way. Health plans are required to have community advisory committees, but in our research, it really looks like those committees aren't really influencing very much of what's happening in a health plan. And we really want to make sure that beneficiaries are able to be centered in decision-making around healthcare interventions and other policy decisions that health plans make that have a direct impact on the people that they serve.
Yeah, and I just want to add to what Gabriella just said. So what we're seeing is a lot of, whether it's a healthcare provider or some other for-profit entity that is in the healthcare space. A lot of them are launching their own health equity initiatives, but kind of doing it in isolation of the community's voice and the people who are supposed to be impacted and benefit from those health equity initiatives. And so to me, it's very internally focused because and when they also talk about inclusivity, right, they're not including the voices. From what I've seen, I'm not saying everybody, but just from what I've seen in my observation, they're not necessarily including the voice of the community or having community representation as part of those initiatives when they're shaping what their initiatives will look like and how they're intended to impact the communities that they serve. So to me, that's a missed opportunity and also a good example of the disconnect, I think. Yeah.
Very much. If anybody wants to add on, if not, I have another question.
Well, I'll just add on, because I know you posed a question to me, Amber, but I'll close it and say,
Didn't mean to put you on the spot, Betsaben.
No. I just thought it would be better if others started. But here's the connection around like access to nutrition. Our research has said over and over that there's access to nutrition benefits, access to CalFresh program and other nutrition programs have better healthcare outcomes for participants. And we truly believe that having access to nutritious food available whenever, however they want, gives them better health outcomes. And something we're really trying to do better in some policy work is making sure there's information sharing between our healthcare system, our medical health system, to connect people to our other nutrition programs like CalFresh and WIC and others, because we've seen the data around this and we strongly believe there's really great health outcomes. And so we look forward to continuing to do that work, but we know there's just challenges with within our healthcare system and the way the structures work and our mental function.
Very much.
Sorry, can I add one thing? Okay, so I think the thing that's hard about the person talked about the power of the healthcare industry, right? The audience member asked the question. And I think to go to Gabriella's point, like we really need some change in terms of governance in our healthcare systems, because consumers really have very little say in how the system is designed or even how they experience it right now, because we don't connect how consumers feel about their care to what we buy basically in healthcare, right? And the state of California has tremendous leverage here, right? Because the state spends billions of dollars buying healthcare from health insurers for our folks, right? And so I think one of the key things here in terms of getting health plans and others to step up is for the state to play a much more active oversight and regulatory role. And I think the state has not historically been good about that, but it really is, I think, where the levers are for us to make some change.
Thank you. We have another question and anyone can answer it. How can health equity advocates collectively build power and ultimately be more successful in policy and systems change? We'd like to get started. It's a good one.
I don't have thoughts around answering that question, but what I wanted to say is, like, our healthcare system is very complicated, right? And when you look at what the United States spends on healthcare as a nation compared to other developed countries, right? We spend the most on healthcare and we have the poorest outcomes, regardless of race, right? We also at birth have the worst life expectancy of all developed nations. Again, even though we spend the most on healthcare. So the system itself is already broken before we start to talk about the inequities and everything else, that is within that system. So, it's very complicated. And I don't know how to break that down really to kind of begin to deal with what we need to do to make transformational change. I think we can, I think a question you asked earlier about maybe the transformation. I think, acknowledging that we have a problem in the first place is like the first place to start, whether it's, the racial inequities or racial bias that exists, is acknowledging, yeah, that is true. And people of color and people who are of different sexual orientation, experience that every single day. And so acknowledging that from the onset, I think is a good starting point. And beyond that, I'll turn it over to my colleagues to provide some additional commentary.
Gabriela.
Yeah.
Just two quick things. I think the first thing that advocates can do is really look at how they are sharing power with community members who are being directly impacted by their advocacy. And when I say that, are community members being listened to? Are they designing the policy and systemic changes in partnership with the advocacy organization? And second is really focusing and looking at intersectionality. When it comes to children, there are two major systems that impact and shape their lives: our health system and our public education system. And at the Children's Partnership, we're trying to eliminate silos between those systems. And we see that as a really powerful opportunity to build a collective coalition around multi-sector advocates whose work impacts children, but who might work on different issue areas. So really building that sort of infrastructure that builds, that brings coalitions and different advocates together and really eliminates silos for us is a huge opportunity.
Thank you. But Isabel, how can we be more successful in these policy and systems changes?
Yeah, I mean, to Gabriela's point around making sure that our policies are inclusive and that those that are directly impacted or would benefit from that policy change are at the table, making that policy change. That's something we've made sure that it's something we do within our Food for All campaign, having communities be part of our policy and strategy discussions. And I'm hoping to see more of that across other different spaces and other work around policy change. I will, the other thing I'll share, you know, and to Rhonda's point around how complex our healthcare system is, you know, I truly believe our healthcare system has been designed to essentially create barriers and challenges for communities of color, and especially when it comes to immigrant communities. When you pair sort of the healthcare system with immigration status and you look at eligibility, it is so complicated. I mean, it is when I used to talk to community members about what programs they were eligible or could be eligible for, it was so complicated to understand their eligibility because there's so many immigration statuses, and there's so many processes of where they're at, you know, in their immigration status. And often, you know, putting those two systems together was challenging, and many people just felt like it was inaccessible and didn't even want to deal with our healthcare system. So I think that it was built for that, and us as advocates, I think we need to really work with alongside our community partners and direct community members to really change our healthcare system.
I think Kieran, you're next.
Sure. So I appreciate everything the panelists have said. I think the only things I would add, you know, a lot of people talked about complexity, and I think one of the things we as advocates are not good about is removing that complexity when we talk about issues. So one thing that I think is really important is sort of focusing on our messaging and our framing and really bringing it back to the values that we all share so that we can move decision makers, change attitudes, change opinions on these issues. The other thing is really building our power, right? Building our civic power, building our electoral power. I mean, people of color are majority in the state of California, right? So we shouldn't have to be fighting for scraps anymore. And I think particularly the Latino community, the single largest voting bloc, right? And so really thinking about how do we engage, how do we make sure our folks are registered to vote and casting those votes and involved, to me is really key in being able to advance bolder health policy issues.
Perfect. And we're already at 1 o'clock, but I really would love everyone to give us maybe about a minute, a closing statement. Rhonda, would you like to get started?
Thank you very much again for the opportunity to be here today, and always to be in the presence of some amazing women and leaders doing amazing work here in California. And I would just say, you know, I think for us, when we talk about, you know, advocacy and power building, you know, and to Kieran's point, I think coming together with our collective voice can definitely make a difference. And I think we've demonstrated how powerful that can be in some of the work that we've done together this past year. And I think being intentional and continuing to do that going forward, I think we can have a greater impact and really affect the shift that we need, and also transform how healthcare happens in California. I mean, if you look at history, right, California has sort of been the bellwether for what happens or can happen in healthcare for the rest of the country. So if we can be innovative, we can come together, collaborate, and really, you know, make shifts in policy change at the system level. That is what I hope we can accomplish together and see happen in the year or so going forward.
Rhonda, Isabel?
Yeah, thank you everyone for the invitation to speak. Yeah, I mean, I'm really excited for next year. I look forward to learning more about all the policy priorities that our partners have, and how do we collectively make that change, that powerful change in our state. I think our state has already passed so many inclusive policies and bold policies that have made us a model for the nation, with Medi-Cal for older adults, creating a better healthcare system. Lots of great investments that I think we just need to continue that, and we're committed to continuing our Food for All campaign, so we can finally end that discrimination and exclusion from our nutrition program, which is excluding so many immigrants just because of their immigration status. So thank you.
Karen?
And I would just say, the one thing that I think about a lot is how do we, instead of focusing so much on the problems, right? And we at CPEN, we're very guilty of talking about disparities, right? But I think what's really important is that we have solutions, and they're in our communities, and our communities are brilliant, right? And know exactly how to change things. So really building on those strengths and those assets, I think is probably the most important thing that we can do as advocates. And just thank you so much to LCHC for hosting this and for having me here today.
Well said. Gabriela?
Just thank you so much to LCHC, and I'm just so honored to be part of this great panel of women. It's been really incredible. My just last closing thought is to not let children behind, not leave them behind, and make sure that in health equity conversations that children are also considered as a population that really need to be looked at and addressed when it comes to health equity.
Thank you so much. We have powerful women today with us, so I really want to thank you because it was also a very powerful conversation. I think to reiterate what we got from this is we really need to listen to each other. We may have different issues, but the goal tends to be the same one. Working together through communities will create change. And I really want to thank all of you for giving the communities their own voice through your work. So thank you so very much to all our panelists. And of course, many thanks to our audience for joining us. This marks the end of our formal conference. Follow us on social media and join our newsletter for active updates. And up next, for those of you who indicated that you were interested in continuing the conversation in a smaller group discussions, we will now be transitioning to our breakout sessions. Join the LCHC team in Manos a la Obra. Let's get to work. Breakout sessions to craft the 2022 Latinx Health Policy Agenda. And for those of you participating, you should have already received a separate Zoom link. So we'll see you there. And for everybody else, thank you for joining us for this year's Latinx Health Policy Summit. Please stay safe. Muchas gracias, and we'll see you soon.